This week, we are celebrating the International Infection Prevention Week. The 2019 theme for International Infection Prevention Week is Vaccines Are Everybody's Business. Vaccines present an easy way to stay healthy and prevent infections from spreading. So how can vaccines be a part of infection control? According to CDC, in one single needle prick of contaminated needle, you have 30% chance of acquiring hepatitis B virus, 3% chance of getting hepatitis C virus, and 0.3% chance of having HIV. All of these lifelong diseases from one single prick. So what can we do to avoid all of this? For HIV and hepatitis C, you just have to avoid getting pricked and wear your PPEs. But for hepatitis B virus, you can be protected against it. How you can be protected against hepatitis B virus? It is through vaccination or immunization. Do you know that vaccines can also protect you from viruses coming from a single sneeze? A sneeze or cough can spread viruses such as influenza, measles, mumps, rubella, and chickenpox. We have hepatitis V vaccination, varicella or chickenpox vaccination, MMR vaccination, and Tdap vaccination. And flu vaccine, which is coming soon. Announcement will be out soon. But of course, infection control doesn't stop in vaccines. Nothing beats the concept of keeping our hands clean. Let's watch a short clip of proper hand washing. Next is a World Health Organization clip for hand rub.
Please note that this technique is not appropriate when hands are visibly dirty or after using the toilet. In these cases, hand washing is required. Hand rubbing should take you 20 to 30 seconds. Use a timer or count 1, 2, 3, 4, 5 in each of the following steps. Apply a palmful of alcohol-based hand rub in a cupped hand, enough to cover all surfaces of the hands. Rub hands palm to palm, then rub right palm over the back of left hand with interlaced fingers and vice versa. Rub again palm to palm with fingers interlaced. Rub the back of your fingers to opposing palms with fingers interlocked, repeating this action for each hand. Rub rotationally left thumb clasped in right palm and vice versa. To clean the tips of your fingers, rub rotationally backwards and forwards with clasped fingers of right hand in left palm and vice versa. Once dry, your hands are now clean and safe.
Infection control also includes wearing of your personal protective equipment. So on putting your PPE, you should first perform hand hygiene. Then put on gown if needed. Next, put on your mask or N95 mask. Next, put on eye protection. Then lastly, put on your gloves. For removing your PPE, first you have to remove your gloves, next your gown if you wear one. Then perform hand hygiene with soap and water. Then remove eye protection and your mask. Lastly, perform a hand hygiene with a hand rub or soap and water. Let's watch a clip of proper cough or sneeze etiquette that we can use in our everyday lives. With all these things being explained and said, always remember that infection control is in your hands.